Welcome back here to Fox 51 today. Katie, we continue to talk about East Texas being really a medical mecca. So many great things and so many informative events to keep you in the know about what's happening. And I can't think of a better thing than talking about breast cancer awareness, continuing to get the word out.
This is a big one. If you haven't had someone close to you that has had breast cancer, then sometimes you know about it, but you don't really think about it. When our very own Jennifer Keelman at our sister station was diagnosed with breast cancer, we all started learning more about it. And I think there's a lot of people out there that have that same thing going on.
That's right. And now this month will be the Community Forum and Educational Conference, the 15th annual Tyler Breast Cancer Conference for 2012. Dr. V is here joining us this morning. Doctor, please tell us your full name, just because I love hearing you say it.
Svetislava Vukelja.
You don't hear that every day, and I absolutely love it. Dr. V, and it's okay, we'll call you Dr. V.
Yes, stands for victory.
Yes,
sure.
I love it. Okay, now, how critical is keeping women and men fairly in the know here in East Texas about breast cancer?
Okay, I'm so glad you said and men. Yes, very important. I think what's important is that, you said Tyler is a small place, but it's a mecca. We bring the latest development, this for the last 15 years, to the community forum, which is the night before the conference for the medical people, medical doctors and nurses. But the community forum will bring development, the latest in development about breast cancer. It's open to the public, and I just like the people from the community to come in and learn the latest. And then the next day, the 24th of February, we have a full-day conference, and I like to bring things, the development here, closer to home. So you don't have to leave town, and yet you can find out how much we have made progress since the last conference. So I think it's been a really great tool for people to learn, for patients to see how hard we're working, how much progress we have made. And every year it's something new happening.
What kind of new things are you going to have at the conference this year?
Well, I think, we are tailoring the therapy to the patient. It's not just every patient gets the same treatment. We are studying the tumor, the genetic of the tumors, the genetics, and what is specific about your breast cancer as opposed to someone else's breast cancer. So, we're trying to minimize the side effect and optimize the response to the particular therapy.
Well, and that's the great thing about this community forum, as you mentioned, Dr. V, and so important for husbands or boyfriends or just friends, men, to come along as well.
Yes.
Understanding how to examine and understanding the dangers and the risks of breast cancer.
Yes, and the things that you said for male is important too. I don't know if too many people know that male can get breast cancer too. It's not as common. It's 1 in 7 in women and 1 in 100 for men. But we have had patients who have read or seen things on television about male breast cancer, what are the symptoms, and actually came forward because of that.
Oh, that's so great. And that's why these community forums, we know, Dr. V, are so critical. Give us the dates if you can, or how people can find out more information about this community forum.
It's the 23rd and 24th of this month, March. Okay. It's an evening event for the 23rd. Starts at 6:15 at Harvey Hall, and it goes till about 8:30, and there will be some refreshment, and there will be time for questioning. And then the next day we start at 7:30 in the morning. It's a full day, the 24th of March, and that's of course for some medical staff.
Right. Okay. But a lot of great information out there. We encourage you to go. The 15th annual. Always more information to be had at these events. Dr. V, a pleasure to have you here this morning. Thanks for all the work you're doing. We really appreciate it. A pleasure to have you here.